Thank you for organizing this very important event, and of course for inviting me to say some things which I think are important on what we are doing related to pancreatic cancer and cancer in general on European level. As you all probably know, healthcare competencies are primarily on a national level. So member states are responsible for financing, managing and organizing healthcare. And this has unfortunately been used as an excuse for EU not to do the things which it can do to resolve problems which member states cannot resolve by themselves. This has changed for two reasons. One, of course, is COVID-19 pandemic, but the other is the political initiative by my political group, the European People's Party, to make the Europe's Beating Cancer Plan. And for these two reasons, because of these two issues, healthcare has, from a marginal topic in the European institutions, become one of the most important topics most discussed in the Brussels bubble. What is important is now that there are new topics emerging, or there are new topics are already there, like prices of food and energy, war in Ukraine, etc. But what is important now for us to maintain this momentum and to maintain this focus as much as possible in Brussels, in European institutions on healthcare. And for this reason, these kinds of events are very important, and this is why I always try to be part of them as much as possible. When we speak of cancer, obviously, in general, the most important document that we have on European level is Europe's Beating Cancer Plan. So we have the Europe's Beating Cancer Plan, and because of this, European Parliament created a special committee on beating cancer, which more than a year ago produced a report on how to improve the Europe's Beating Cancer Plan. And there we determined our positions, and I was deeply involved also in the work of this special committee. When we speak about Europe's Beating Cancer Plan, what is important is that it is first such comprehensive plan on European level, but even more important, so it covers all phases, so research, prevention, early detection, treatment, and afterlife of cancer survivors. So all of the phases of fighting against cancer. And this is something which can be seen as a real breakthrough on the European level, and especially because in this plan we have concrete measures, concrete targets, concrete benchmarks, and very strong funding of more than 4 billion euros from EU budget. So when we speak about these concrete phases, I won't go into too much detail because we don't have the time. But first phase, which is covered by the Europe's Beating Cancer Plan, is research. Of course, cancer research is crucial for the developments of new technologies, of new medicines to beat cancer. And here it is very important that we were able to achieve that that cancer becomes, fight against cancer becomes one of the priority missions of the Horizon program. We have several calls which are already also within the Marie Curie program related to pancreatic cancer. So this research on cancer has really become very important, and cancer and healthcare in general have become one of the priorities of the Horizon program, which is the main European program for funding research. Next, there is prevention. Prevention, obviously, very important. That's probably the strongest part of the plan. We know that more than 40% of cancer cases are preventable. So this is why we have lots of provisions in the plan on that. Also, early detection screening. That is a topic that will probably be discussed today to a large extent. This is also one very big part of the plan, but this can also be improved. So the focus is on certain types of cancer, but I think it is important that we also expand it as much as possible. And also to provide European Union funding and support to the member states when conducting their own screening programs. The biggest part of the plan is about treatment, I think, because as we said, treatment is primarily a national competence, and we don't have a lot of provisions, concrete provisions and concrete actions about how to provide treatment. I think most important part of this is the creation of European Cancer Inequalities Register, so register where we will be able to map inequalities in cancer provision in Europe, which is very important because you have much bigger chances, more than 40% bigger chances of dying from cancer in some countries of Eastern Europe than in the most developed countries of Western part of the EU. So these inequalities are a big problem, and they need to be tackled by investment into health infrastructure, into health workforce, specializations for doctors, for nurses, providing better working conditions. So all of this can be funded from EU budget, from cohesion policy, from recovery and resilience facility, from EU4Health. So we have to do much more in that area. One thing which where the plan didn't go far enough is the cross-border healthcare. You know that EU law gives patients the entitlement to access healthcare abroad if they cannot get adequate treatment at home, and this treatment is paid for by their own health insurance fund. However, this legal framework on this right is very complicated. This is something that not even all health lawyers understand. Patients are not aware of their rights, and this situation is a big problem. So what we proposed as the Parliament is to simplify this legal framework, to merge two sets of reimbursement rules, because now we have two. So we propose to merge them into one. And what is important, so that we don't have anymore the situation where patients have to pay upfront for their healthcare treatment and then ask for reimbursement, because this is a big disincentive for patients to go abroad and get healthcare. They have to pay the entire cost out of their own pocket and then ask for reimbursement afterwards. So what we are proposing is to have one system whereby health insurance funds will settle the bill between themselves and with the providers directly, without having to charge the patients for that. So, and also what we also proposed is the entitlement to so-called second opinion, so that not just the domestic experts testify where best possible treatment is available to patients, but also best experts in European Union can say through this procedure of granting approval for reimbursement, so that best experts in Europe through European reference networks can say and determine where the best possible healthcare treatment is available in the EU in case patients cannot get adequate treatment at home. So this right to so-called second opinion is something that is very important for the Parliament. And also there is the afterlife of the patients. So this is also something which European Parliament takes very seriously, and we proposed as the Parliament to improve the World Pancreatic Cancer plan by including mandatory rules on the European level which would prohibit discrimination of cancer survivors when, for instance, negotiating about life insurance contracts, financial services, etc. Because we know that in many cases, cancer survivors, because of the fact that they survived cancer, need to pay higher premiums for insurance, which is unacceptable for us. And this is why European Parliament proposed to have a mandatory legislation on EU level, which will make which will prohibit discrimination in all member states of the EU, not like we have it today that some member states prohibit this and some member states not. And this is also one area where plan didn't go so far. The Europe's Pancreatic Cancer plan did not provide for such a mandatory legislation, but this is something which is very important for the Parliament, that people protect patients' lives by doing that. So this is overall the most important area, most important issues related to the Europe's Pancreatic Cancer plan, and of course all of this is relevant to pancreatic cancer. Unfortunately, pancreatic cancer has not been one of the most talked about types of cancers, and we need to change this. And this is why these events are so important. You all know that probably pancreatic cancer is the most deadly type of cancer. So the survival rate is less than 10% in 5 years, and which is much worse than for any other type of cancer. But what is even worse is that death rates are increasing, and that we really haven't seen an improvement in terms of better health outcomes in the last 30 to 40 years, which is also unlike the situation that we have for other types of cancer. So we are really not moving forward, but we are still stuck in this very low survival rates, and this is an enormous problem. And this is why we need such events, and we need to see what we can do on EU level, what kind of measures which are specifically targeting pancreatic cancer can be done on European level to really improve the situation, which is now very, very, very bad. And in this sense, I think these kinds of events can help, and I'm looking forward to see the outcome of the conference, and to hear what will be concrete conclusions of this that we can then promote on the European level. One thing that I also wanted to mention, which I think is pretty important, also in relation to healthcare in general, and that is the proposal of the regulation in European health data space. So we know that one of the big problems in fighting certain types of cancers, like pancreatic cancer, is the lack of data. And this is a problem both in case of primary use by healthcare professionals, but also we have many obstacles and many limitations which prevent the secondary use of data. So the use of health data for research and innovation and policy making decisions, etc. So this proposal, for which I have been appointed European Parliament's rapporteur in the Public Health Committee, is designed to resolve this problem. So first, for primary use, so first it will make it possible to exchange data and for data to be interoperable for primary use. That, for instance, means that if you are, for instance, staying for studying maybe for 6 months or 1 year in another member state, and then you have to go see a doctor for a certain condition or to treat a condition, then this doctor will be able to get all of your medical data from your own doctor in your own member state from which you came. And this is something which is very important because it will make health treatment and diagnostics much faster, and it will also be important in terms of not needing to repeat diagnostics which have already taken place. And I think that for all patients, also for pancreatic cancer patients, this is very important because in many cases having fast access to health treatment is crucial, and this ability to access data from other member states will definitely help improve access and making access to health treatment much faster than before. But also what is even more important is the secondary use of data, that is the use of data for research and innovation. So the idea of being able to use data from all member states, from the entire European Union, when conducting research and innovation, also clinical trials, is something which is, I think, probably the biggest added value of this proposal. And this is something that I believe can really make a difference in terms of making and improving health outcomes on the EU level. Also, what is very important is that, and I think this can also be relevant for pancreatic cancer, that we will gather access to much more real-world data, real-world evidence than we have today. And this is also something that can be very important, especially in the area of pancreatic cancer, that this data can also be used when developing new treatments, new diagnostics, and new medicinal products. So I'm glad that I've been appointed rapporteur of this. I will do my utmost to make this regulation go through, for this to be adopted. I will make sure to keep the basic principles of the Commission proposal, but of course to make it better, to improve it, maybe to provide some additional safeguards for the privacy and data protection. But again, the whole idea is to facilitate the use of data and not to create additional obstacles. And I think that we can achieve this on European level, and that this will be also beneficial for all patients, but also pancreatic cancer patients. So thank you very much. I think I'm probably already over time, but I think we have a lot of activities that we are doing currently on EU level. We have the Europe's Beating Cancer Plan, which now needs to be implemented. The implementation has already started, but we need it more. We have to see what kind of targeted actions can be made specifically to tackle pancreatic cancer, because this is as I said, the type of cancer where we have the biggest room for improvement of our healthcare systems. I would have to say also European health data space and the use and better and faster use of data will I believe also help improving health outcomes for pancreatic cancer patients. And I think all of this, if we take all of this together and if we really dedicate ourselves to helping pancreatic cancer patients, that things can improve in the next several years. But what is needed is to keep the momentum, to keep the discussion going, and really to have as much focus as possible on this type of cancer, because we really have a long way to go there. So thank you very much. Thank you for organizing this again and for inviting me. And I can promise you that I will be championing this cause as much as possible. That I will continue to fight for pancreatic cancer patients. And you can count on my support in your future activities. Thank you very much.
Yeah.